Okay, good afternoon, everyone. My name is Ashwini, and I'm the International Medical Director at AstraZeneca. What does international cover? Oh, I sound like Mickey Mouse, but okay. What does international cover? It's everything outside the US, Europe, Japan, and China. So it's the rest of the world. So, as part of our vision to transform care, we have a special interest in cancer, and especially in the low middle income countries and the middle income countries. I don't have to tell you this already. As you know, lung cancer is the leading cause of cancer deaths. And what we're trying to do is shift the staging, as Professor Yang had mentioned, from stage 4 to stage 1. Now, earlier lung cancer detection and diagnosis is critical in reducing the lung cancer burden worldwide. But what about in the low middle income countries? In the low middle income countries, resource limited healthcare settings are in need of cost effective early detection solutions. Low-dose CT scan will always remain the gold standard, and we will not take that away. But can chest X-ray, which is enabled with AI, play a role in triaging patients into low-dose CT scan? So I'll share with you three pieces of evidence that we presented recently. This is a mini oral we presented at ELCC just last week in partnership with Cure.ai, which is an AI-enabled solution partner. And this is a technology of AI-enabled chest X-ray with a validation model using lung nodule malignant score. So what we did was we validated this in the real world setting based on two ground truths. One is the radiologist assessment, and the second one is based on CT scan. So this study was carried out in 5 countries: India, Indonesia, Mexico, Turkey, as well as Egypt. It had 700 individuals participate in the study. And what we looked at was the patient got an AI with chest X-ray, and that patient was then stratified into high risk and low risk based on the lung nodule malignant score. The patient then was validated as high risk, low risk. This patient then received a low-dose CT scan. Now, the results of this high risk and low risk were validated by the radiologist, as well as the low-dose CT scan based on Lundrat scores, Likert scale, as well as the Mayo Clinic model. The primary objective that we looked at was the positive predictive value and the negative predictive value of QXR lung nodule malignant score in categorizing high risk and low risk malignant nodule against the malignancy risk as assessed by radiologists using the Lundrat score. As a secondary objective, we looked at the clinical demographic as well as agreement between the QXR lung nodule malignant score and other alternate risk malignant risk scoring, such as the Mayo Clinic model and the Likert scale. So the primary outcome of the study showed that the positive predictive value was 54.1%, which means out of 100 individuals who got validated as high risk by the chest X-ray and AI, 54 out of 100 were validated by the radiologist as well as the low-dose CT scan. In terms of the negative predictive value, out of 100 individuals who was said to be low risk by the QXR lung nodule malignant score, 93 out of 100 was said to be low risk by the radiologist as well as the low-dose CT scan. And hence, this was reducing the number of individuals who would then proceed to do a low-dose CT scan. Again, in terms of the Mayo Clinic model, there was a 70.7% agreement with the Mayo Clinic model and the QXR lung nodule malignant score. And in terms of the Likert scale, there was an agreement of malignancy of 59.5% between the Likert scale and the QXR lung nodule malignant score. So what this tells us is that the CREATE study is showing us that the use of AI-enabled triaging of incidental chest X-ray can optimize lung cancer screening workflows across diverse healthcare settings. At ELCC, we also presented a budget impact model based out of Vietnam, which looked at the clinical and budget impact of using AI in X-ray at a population level in Vietnam over 5 years. And what this saw was 4,742 premature deaths were averted. An additional diagnosis of 3,155 cases was seen. And in terms of the budget impact, in the first year, there was a positive additional budget required. But in the following years, the budget impact is negative, leading to cost savings. And by the fifth year, the overall cost neutrality is achieved in initial costs was recouped. This is one of the many models that we will be putting out as a form of evidence in the upcoming years. Now, last but not least, again, as part of triaging and using AI-enabled chest X-ray to triage individuals, can this be integrated into an existing screening tool in a low-middle income country, such as the TB screening program? So if you look at this study from Vietnam, you will see that what we did was we used AI-enabled chest X-ray images obtained during TB screenings and identified potential lung cancer nodules as well. So patients came in, they got a chest X-ray in AI. It was TB related, they would get further assessment for TB. It was a lung cancer related nodule seen, they would get a further assessment based on that. Now, based on that, what we saw with 135 individuals who received chest X-ray, we have diagnosed 133 lung cancer cases. And what this means is with a triaging with chest X-ray enabled AI, for every 4 low-dose CT scan done, 1 lung cancer is detected. So this is also another addition to the body of evidence in support of AI-enabled triaging, which can then funnel through to low-dose CT scan. So with that, I will conclude by saying AI-enabled chest X-ray triaging can optimize lung cancer screening in resource-limited settings. And hopefully this is some food for thought for you to how do we expand lung cancer screening beyond the smoker population and integrating AI chest X-rays or any form of solution to aid low-dose CT scan screening of lung cancer. Thank you.